Hello everyone. Today we the students of Kanya Mahavidyalaya got an opportunity to perform a DBT project on the topic PCOS among KMV students. I'd like to thank Mrs. Sadhna for assigning this project to us and also my team members Deela and Simranjeet for the cooperation. So the aim of our project is to have a survey on the prevalence of PCOS among KMV students. Objective is to know the disease name PCOS, to recognize its symptoms in students and mothers, to take a survey on the disease and to have a study on the same, to get to know the prevention methods and its effectiveness. So PCOS, Polycystic Ovarian Syndrome. It is a disease common amongst the women of reproductive age. Women with POCS have infrequent menstrual periods or excess male hormone levels. The ovaries may have numerous small collection of follicles and fail to regularly release eggs. When the woman develops this illness, it can lead to disease like diabetes, high blood pressure and problems with heart and blood vessels and urine cancer. They may also face problems with conceiving. These are some images with ovaries with POCS. This is a normal ovary and this is polycystic ovary. Types of POCS: insulin resistant POCS, pill induced POCS, inflammatory POCS and hidden POCS. Causes of polycystic syndromes are excess insulin. Insulin is the hormone that is produced in pancreas that allows to use sugar. If the cell becomes a resistance to insulin, then the level of blood sugar increases. The body produced more insulin, which in turn produced more androgen, causing difficulty in ovulation. Second one is low-grade fever. Inflammation. This term is used to describe white blood cells production of substances to fight infection. Third one is heredity. Research suggests that certain genes might be linked to POCS. Fourth one is excess androgen. The ovary produced abnormally high levels of androgen, resulting in hirsutism and acne. Now, genetics of polycystic syndrome is it is a familial condition and has long been noted. Some clinical genetic studies have pointed to an autosomal dominant inheritance, while others show that it was more likely that the syndrome is complex trait with allelogenic basis. Although clustering of syndrome is complex, strongly support the role of genetic factors in the development of POCS. This has resulted partially became of various factors such as lack of worldwide accepted diagnostic scheme of POCS, diagnostic capability only in reproductive age women, limited number of patients in case control studies, analysis of only one or two variants of candidate genes, and incomplete knowledge of pathophysiological of this syndrome. Polycystic ovarian syndrome causes high level of androgens, high level of insulin and obesity, low-grade inflammation and heredity. Symptoms of POCS are irregular periods. Infrequent or prolonged menstrual cycles are most common in POCS. The person may have fewer than 9 periods a year, more than 35 days between periods and abnormally heavy periods. Second one is excess production of androgen. Elevated level of male hormone may result in the physical signs such as excess facial and body hair and occasionally serves acne and male pattern baldness. Third one is polycystic ovaries. Ovaries may have many follicles and the ovaries fail to function normally. Fourth one is heavy bleeding. The urine lining builds up for a longer period of time, so the periods will be heavier than usual. Fifth one is darkening of the skin. Sixth one is head aches. Hormonal changes can lead in some women to head aches. Eighth one is women with POCS can have overweight. Now 10 signs and symptoms of polycystic ovary syndrome. Irregular periods, absence of menstruation, hair thinning and loss, abnormal skin discoloration, excess facial and body hair, high blood pressure, stress, depression, weight gain and acne. Now, diagnosis of POCS is the test. No single test has diagnosed POCS. Your doctor will start by asking about your symptoms and medical history and by doing a physical exam and possibly a pelvic exam. They might give you a blood test to measure your hormone levels, blood sugar and cholesterol. An ultrasound can check the ovaries for cysts, look for tumors, and measure the lining of your uterus. Now, prevention methods. To help to reduce the POCS, take care to maintain a healthy weight, limit carbohydrates, be active, and medication. Medication is must. Gratitude and acknowledgement. We extend a sincere thanks to our respected ma'am, Dr. Sadhna Tandon, who was our constant guide to complete our project. We are grateful to the students of KMV who cooperated in the informative way survey. We thank all of the help rendered to us faithfully. Conclusion is polycystic syndrome is a common disease in the women during the time of menstruation. A good control of healthy diet and proper exercise can reduce the chances for this disease. We could find that if we treat our body with care during our menstrual cycle, we can somewhat check the disease. Thank you so much.